relief from sensitivity.
Nigerian youths are about the greatest assets the country has at the moment. It is therefore not surprising that the administration of President Muhammadu Buhari is strategically responding to the yearnings of the youth through multiple projects and programs. Youth entrepreneurship support years by Bank of Industry, the Youth Investment Fund by the CBN, and several other conditional cash transfer programs. Recruitment of 774,000 social workers, majority of whom are youths, and so many other projects that are beneficial to youths directly or indirectly. If the administration can do all this, definitely with a degree of patience and time, it can achieve more. Nigerian youths must come together to say no to terrorism, no to vandalism, and no to all disruptive tendencies. Hashtag Youth for Greater Nigeria, pacifying the youths, unifying the nation.
Now, as a prompt for the conversation on handling COVID-19 vaccines, let's take this background report put together by Kunle Adeye.
COVID-19 took the entire world by storm in 2020 owing to its contagious nature. Researchers, globally Nigerians inclusive, began to look for a remedy, which is production of vaccines. It seemed like hope in sight that would take a longer time, but after clinical trials, the World Health Organization approved that some vaccines be administered on people. Nigeria eventually received about 4 million doses of the Oxford AstraZeneca COVID-19 vaccines early March. With many states in the country receiving their consignment of vaccine and vaccination in process, there have been reported cases that this vaccine is being mismanaged at some designated vaccination points in Lagos State. The National Primary Healthcare Development Agency has, however, reacted to these allegations, saying it is being investigated. Consequently, it has assured that appropriate action will be taken against anyone found culpable. Will this development not affect the seemingly smooth process of vaccination in Nigeria? Could this be attributed to lack of coordination of state officials handling the vaccination? Will this not lead to loss of trust by citizens on the transparency being assured by government? Guests are seated to provide answers and give more insights on Good Morning Nigeria.
All right, thank you very much, Kunle, for that background. With us in the studios here in Abuja, I would like to welcome the Executive Director and CEO of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib. Dr. Shuaib, delighted to have you this morning.
Good morning, viewers. Thank you for having me.
And joining us via Zoom from Lagos is the Director General of the Nigerian Institute of Medical Research, Professor Babatunde Lawal Salako. Professor Salako, delighted to have you with us this morning as well.
Thank you very much. Good morning, viewers.
All right, good audio there from Professor Salako. Kieran, let's begin with
Dr. Faisal Shuaib, I take it that you have the information with respect to the discrepancies in the management of COVID-19 vaccine in Lagos. Right. What's your reaction?
Well, the information that we have is that people who are not eligible in this first phase of the COVID-19 vaccination are going through the back doors with collusion with officials of the Lagos State Ministry of Health and are actually accessing the vaccine. You probably will have seen some of the reports in the media about some of those inappropriate access of some individuals to the COVID-19 vaccines. We've been very clear that we have faced the process of accessing these vaccines into 4 distinct phases. The first phase is for those frontline health workers, their support staff, other health workers, and then first responders, people who are likely to come in frequent contact with crowds. And then we've also pointed out that because we need strategic leaders to symbolically take the vaccines and actually indicate the safety and effectiveness of the vaccines, that they are also categorized into the first phase. The second phase is for those individuals who are elderly, those who are 50 years and above. The third phase is for those who have comorbidities, so people who have underlying diseases that are likely to worsen because of COVID, when they contract COVID-19, people who have hypertension, diabetes, heart disease. What the evidence shows is that they are likely to suffer more and have a higher mortality rate when they contract COVID-19. Then the fourth phase is for anybody who is 18 years and above. So what we're hearing from the report so far is that there are some centers in Lagos, particularly at the Falomo Clinic, where this framework is not being followed. My understanding from the communications that I've had with the Lagos State government is that this is being investigated. We had hoped that the report would be available before now, but again, we checked back yesterday and we understand that they are just finalizing the report.
Well, are there timelines allocated to the various phases? Say frontline health workers and other support staff, phase one. Second phase, persons who who are elders, 50 and above, as you indicated, and comorbidities, and then the others who are 18. Are there timelines scheduled for these phases, or it's on the basis of first come, first served?
Yes, there are two criteria that we've used, depending on which comes first. We expect that within the period of 8 to 10 weeks, the phases should have been concluded. That is to say, phase one ought to have been concluded, depending on how fast the states are able to roll out. But the second criteria is also that it's predicated on how fast they're able to vaccinate. So, for example, if you're able to cover your population under 8 weeks, then that means you've ended that phase. So that is also dependent on the availability of vaccines. As you're well aware, we have to get these vaccines from outside the country. So starting off with the next phase will be dependent on the availability of the vaccines.
And who determines who gets a jab? For instance, at Falama you're talking about, you specify that the first phase is well, we can easily identify frontline workers, who are maybe the nurses and other workers within the medical facility. Well, I know we have nurses, we have cleaners, we have other persons. So who determines who gets that? For instance, when you say that the second phase for those persons that may have other ailments, like hypertension and what have you, how do you make selections? Who is responsible for selections? Because what we are saying is that people, the story about Lagos is that some people are coming through the back door. Those who are not eligible for now are coming in. Persons are making it possible for you to work. So who are those people responsible? Who are the key persons responsible for determining who should get this jab? The faces already mentioned, yes, but then some persons may come. Lagos is a very big state, and again, the vaccination we have in Lagos cannot go round in Lagos. So there may be some kind of backdoor arrangement where people would like their own relations to come and get this vaccine. So I'm confused about who determines who gets this jab, even when the person is eligible to get it at this point.
So we're following the recommendations that have been provided by experts, right? And it does follow that those who are likely to get the disease should take the vaccines first. So the health workers who are in the front lines should be the ones that should get the vaccines because they're in constant touch with the patients. These recommendations have been shared, they've been agreed with the states. So there is no controversy or any confusion, like you rightly mentioned, about the phasing and who should get it. It is now the responsibility of the states, the health officials of the states particularly, to implement that guideline. So in any state, the person in charge of the health sector is the Commissioner for Health, right? But he provides overall coordination. He's responsible for the policies. But when it comes to implementation, this implementation is nested within the state primary healthcare boards. And there is an executive secretary or a permanent secretary who is responsible for this implementation. So it is also under the remit of his leadership to make sure that at the subnational level, that designated individuals also make sure that these guidelines are followed. So from the state level, you go to the local government level, right? From the local government level to the ward level, the health facility level. So if you think about it, the executive secretary is responsible for the implementation, but at the local government level, there's a medical officer of health in Lagos State who is in charge of primary healthcare implementation, right? And he designates and appoints people who are responsible for each team. So like the Falamo Clinic, there is a team that has been constituted who are staffers of the Lagos State Primary Healthcare Board. There's a team lead, there's a supervisor in the team, there are vaccinators and recorders. They are the ones that are supposed to make sure that they follow the guidelines and implement as has been guided.
Why does the non-compliance, apparently, with the stipulated procedure for vaccination at the police clinic in Falamo, why does it matter?
Well, it matters because it sends a very wrong signal, right? That, there's lawlessness, that we are people who are not following the guidelines. And if we allow it to go unabated, then it becomes a situation where all comers will, want the vaccines. What we are seeing is that contrary to all of the media, social media hype that, the vaccines are not going to be taken, we see a lot of demand for the vaccines, actually. Clearly, what you see in a situation like in Falamo, where people are going through the back door to get the vaccine, is that there is demand. There are people who really want the vaccine. Of course, there are people who are hesitant. If people don't have information about the vaccines, they will feel like, oh, why should I take the vaccines? Again, there's a lot of work that needs to be done there, but there are also people who want to get the vaccines, right? So we have to be sure that there's consistency in the implementation of the guidelines. So clearly, Kingsley, we have a situation where the common saying is that Lagos is the center of excellence. It is the commercial nerve center of Nigeria. I think this crisis around the management of vaccines will be a litmus test as to whether Lagos is also the North Star when it comes to integrity, when it comes to ethics, when it comes to implementation of our programs. And I know that the governor is on top of the situation. The commissioner is trying to resolve this issue. So we'll see what happens in the next couple of days.
It's very pertinent, because the health workers, you rightly mentioned, could bring their relations, to come and take these vaccines. Because if anybody should come through the back door, they must have been aided by those who are responsible for management of the vaccine.
Absolutely.
Exactly. So, all right, now...
Sorry, Kieran, I understand you want to jump into another related aspect. In defining frontline workers, I use workers advisedly, I didn't say healthcare workers. I wonder why the media often is not categorized amongst those frontline workers. Throughout the height of the epidemic, you were our regular guest here on Good Morning Nigeria. You saw all of us were all getting shielded in the course of the program. And our reporters are also out there on the field. Why are media practitioners not classified amongst frontline workers to get a job in the first phase?
No, they are among the frontline workers. I have always consistently indicated that they are frontline workers. But maybe there isn't a lot of push for journalists to get the vaccines first. Because even among people who are frontline workers, there are those who are more frontline than others.
Yes, I will agree with you on that, really,
Yes.
Because a nurse who administers medication on a patient, you cannot compare that to a journalist. But Kingsley just, hit it on the head that we need to be part of these frontline workers with respect to...
Yeah, absolutely. You may recall that a few days, actually, when the chairman of the Presidential Task Force on polio, on the COVID-19 pandemic, took his vaccines during the media briefing. We actually had media practitioners, journalists also took the vaccines, again symbolizing the fact that they are considered as
All right.
frontline
All
frontline
right.
workers.
Now let's go to Professor Babatunde Lawal Salako. Sir, you've listened to Dr. Faisal Shuaib on the issue concerning the management of the vaccine in Lagos, and what will be your own take, based on the information he just gave us?
Well, thank you very much for your question. I believe that what requires to be done is to ensure that the platform created by the MPHCDA is the only one being used by all Nigerians. And within the platform, they can triage people to different states that the state actors can have access to, and then invite people according to the programs of the vaccination given by MPHCDA. What has happened is that the Lagos state has its own platform, which is different from the platform created by the MPHCDA. And the Lagos state platform is not a public one. I got to know this when they came to vaccinate staff at the Nigerian Institute of Medical Research. And they were registering people as they were being vaccinated. And I did ask if that registration platform is open to people. And the lady told me it's not. So they are the only one doing the registration. And that then means that they do not have any structured way of inviting people to come and get vaccinated. Now, if that happens, what we have seen is the kind of things we are going to be seeing, because everybody will scramble for the vaccine and will do anything to get vaccinated, especially if these are people who have the wherewithal to do this. So the MPHCDA needs to discuss with the Lagos State Commissioner for Health to look at their platform. And if they are going to approve that they use that platform, then that platform should be made public so that we know that this platform is for people living in Lagos State. And everybody living in Lagos State can then approach that platform and register. And they can strictly invite people from that platform, and people will go to the vaccination center with their invitation letters that the people at the vaccination center can reconfirm before they then go ahead to vaccinate those individuals. If we are not able to do this, then we are heading for the rocks, because we are just distributing only 4 million vaccines now. By the time we have the remaining coming, we will probably be overwhelmed. This should be a kind of a dry run for us to pick up the teaching issues that are associated with the program. And once we are able to study that, we will then apply whatever challenges that we have seen and find solutions to it. I did register on the MPHCDA platform, and it worked very well. It actually allocated me to a nearby health center where I am supposed to go and get vaccinated. But then, when Lagos State started to vaccinate, this was not being used. So there is a need for both Lagos State and MPHCDA to discuss and meet in the middle to determine which of the platform is going to be used. Otherwise, Nigerians will stop registering when they see that the registration is not as useful as they thought.
Professor Salako, thank you very much. I would like Dr. Faisal Shuaib to respond to this, because what appears to be happening now is that there is the National Primary Healthcare Development Agency platform for registering to get the shot. And then there is also in Lagos in particular now, a Lagos State platform. If you register, you are directed to a healthcare center. But it appears from what Professor Salako is saying that Lagos is going at it alone without reference to your own platform or lack of synergy with the NPHGC. So what exactly is amiss here, and how might this be rectified?
Yeah, thank you very much, Professor Salako. Actually, I'm hearing this for the very first time. We have had conversations with the Commissioner for Health, and he has made it very clear that they are using the NPHCDA platform. I am aware that there is data from Lagos State on the number of people that are being vaccinated. If it turns out after our investigation that Lagos State has a different platform and they're using it for this process, then they stand a risk of actually being barred from getting further vaccines. These vaccines are being provided by COVAX. They are being donated by different organizations, and they are very clear about accountability for the vaccines. If Lagos State is using a different platform, then we cannot account for those vaccines the way they are supposed to be accounted for. And if we cannot account for the vaccines, the donors will be very clear that we cannot send vaccines to those states. No state will also be allowed to procure vaccines on their own, right? This is a policy of the federal government. So I hope that it is not, correct that they have a different website, because that would be wrong on the part of the Commissioner for Health, and that means he has not been communicating honestly with the federal government. But I know him to be a man of good standing in terms of his interactions. But we will have to investigate. But it will be a very bad development if they are to develop a different platform. The platform that NPHCDA and our development partners have developed, it's a platform that is working very well. There are times when, of course, it will have glitches. That happens with every situation where there are internet challenges, where a lot of people are trying to access a platform. And this platform has been optimized, like Professor Salako, correctly said, right? That this is sort of a pilot for a larger scale rollout that we're expecting. So whatever teething problems we have right now, is better we fix it. This is a 2-year potential program of vaccinating over 100 million Nigerians. So this is just less than 2 weeks. So whatever challenges we face right now, we need not to quit. We need to be resilient, fix whatever problems we have, and move together as a country. So I will really urge, anybody who is doing anything different to really seize. And, I will be reaching out to the governor of the state, to find out, if this information provided is correct. It will be very unfortunate.
Yes, Professor Salako, it's quite interesting that you have to, spotlight this issue of the different platforms being adopted. Now, the platform that's currently being used in Lagos, do you think that the practice could lead to any discrepancies or mismanagement of the vaccine?
Well, I don't think so. What I noticed was that before Lagos State vaccinates anybody, they will register that individual. And there was a time the lady couldn't go on because there was the internet facility or strength was weak. That's how I got to know. And we needed to wait for that to come back. So I put a question to her that, is this a registration platform? And she said yes. And I asked, is this public? Can you give the platform to us so that we can register before coming to you, so the vaccination can move faster? And he said no, that it is only on their own phone number, on their own phone. So that's how I got to know that they are ready. Perhaps they are using it to keep their own records. It is not that I'm saying that people are using it to get vaccinated, but they are using it to register people before they vaccinate people. My concern was that we had already registered on MPHCDA platform. And so there shouldn't have been any other platform for us to do that before being vaccinated. However, they have that, and for everybody, every person that they have vaccinated, they had on their own registered those individuals again, which means that they are not using the MPHCDA platform. It may not be that they are doing that to circumvent the program set out by the MPHCDA. They may be using it for their own records, but what I'm saying is that we already have an MPHCDA platform. People who are going to be vaccinated should be invited through that platform.
Professor Salako, thank you very much. I mean, it's, some of the issues are fairly straightforward. If there is a national platform available and it is working, the subnational entities can access it. Whatever data they want from there, from that platform can be mined specific to that state. But what information are you getting from elsewhere in the country where states have received the vaccines? And by the way, which are the outliers that still haven't either collected or are willing to collect the vaccines?
Right. The information that we're getting is that there is actually a lot of demand for the vaccine, and people are coming out. People who are in the first phase are actually coming out. As you can see across the country, state governors, strategic leaders, traditional leaders, religious leaders are actually coming out in public to take the vaccine. So we're pretty happy with the uptake of the vaccine. Apart from Lagos State and this issue that Professor Saloko has raised, no other state is trying to set up a platform. So this is something that we're going to investigate. We so far have vaccinated over 200,000 individuals, and we believe that the platform is working very well. We've also seen a situation where some states took some time before they actually launched, but I know the two remaining states that have not rolled out the COVID-19 vaccination program are Kogi State and Oyo State. I just received information last night that Oyo State will be rolling out today. So we expect the governor of Oyo State to actually flag off the vaccination program between today and tomorrow. We're still in conversation with Kogi State to make sure that they fulfill all of the criteria for us to deliver vaccines to them. So you may recall that during the NSAS crisis, that the cold store of Kogi State in Lokoja was actually vandalized. They've been able to fix parts of it, but there's also the issue that we need additional security for the vaccines. We don't want these very expensive, hard to get vaccines. We don't want to keep them in the cold store and then, vandals come and cut them away. But the Kogi State government is yet to enhance the security of the cold store. So we're hoping that they will do that. Then we will get them the vaccines, and then they can also start the vaccination program.
We're yet to hear that Kogi State is now interested in the vaccine because, what has been in the air over time is the fact that there's no COVID-19 in Kogi State. Now you're talking about the cold store in Kogi. I'm just wondering, Kingsley, when Kogi State indicated interest in the vaccine.
No, well, the governor of Kogi State did say that he wouldn't take the vaccine. He was reported as saying that he wouldn't take the vaccine because he's not ill, he's not sick. I recall we discussed that on Good Morning Nigeria during newspaper review, that you don't take vaccination because you are ill. You take vaccination to prevent you from being ill. All right. So that's one point, Kyria. I would like Dr. Pfizer to also clear this up. An individual is supposed to take 2 shots of the AstraZeneca vaccine. Is that correct?
That is correct.
Okay, so now what we are seeing now for the 200,000 plus that have been vaccinated is perhaps the first jab.
That's correct.
When are they required to take the next jab?
So what we're doing in Nigeria is to give an interval of up to 12 weeks between the first and the second doses. So for those who are already taking the vaccine, their second dose will be sometime in May, right? So the reason why we've opted for the interval of 12 weeks is because there's evidence that shows that when you increase the interval between the first and the second doses from 8 weeks to about 12 weeks, you gain more immune response. So when you do it after 8 weeks, the immune response is, in the 60s. But when you actually increase the interval to up to 12 weeks, you approach 90% in terms of the efficacy of the vaccine. So we opted for that. Besides, what it also does is to provide adequate time for us to get additional vaccines from our manufacturers.
Are we just expecting Oxford AstraZeneca, or are we also expecting others from Johnson & Johnson, Pfizer, and other manufacturers of these drugs?
Right. We're expecting additional vaccines from the African Union, and they've indicated that they're going to provide up to 41 million doses. Part of that 41 million doses will be made up of AstraZeneca and the Johnson & Johnson vaccine. We're also looking at other vaccines such as the Sputnik vaccine that is still that's still undergoing review by NAFDAC and the World Health Organization. The World Health Organization is yet to list it for emergency use. That is a precondition for us to use the vaccines in Nigeria.
Which of the vaccines is one jab?
It's the Johnson & Johnson. That's the Janssen. It's.
Well, I had asked this question on Good Morning Nigeria, and the question was, look, can you take 2 jabs of vaccine from different manufacturers? Can you take, now you have AstraZeneca? I haven't had mine, by the way, and not because I'm a vaccine skeptic. At the appropriate time, I'll get it. Well, you take one AstraZeneca on the left, and then, as you said now, for efficacy purposes, after 8-10 weeks, I go for another jab. When I get it, I'm told that it's not AstraZeneca that's available now. What's available is Johnson & Johnson or Moderna. What am I supposed to do?
No, that's not going to happen.
Okay.
Yeah, that is in the realm of conjecture. We're going to keep adequate vaccines to cater for the second doses. So you cannot take AstraZeneca on your left and then a Johnson & Johnson on your right. No, it is actually the same vaccine that you are going to give. That is why on the platform, we make sure that we actually track what vaccine you've taken as the first dose. So that is exactly what you take as the second dose.
Does it matter on which arm you take the vaccine, left or right?
You take the vaccine in your less dominant arm. So if you're right-handed, right, you take it on the left, okay, right? And then if you're left-handed, you take it on the right, just because you might have some pain, some swelling, and then some people have
some reaction.
Exactly, and you don't want it to interfere with your daily activities.
That's right.
Yes.
All right, let's return to Professor Babatunde Lawal Salako. Sir, from all indications, you are monitoring the management of this vaccine in Lagos. And we would like you to do an evaluation of what we have seen so far with respect to how it is being managed, and of course how Lagosians are keen into the vaccination exercise.
Well, what we have seen is that since the rollout of the vaccine and the leadership of the country and the states have taken the vaccine, a lot more people have shown interest beyond what we used to hear on social media. Even though there's a lot more people who are still hell-bent that they're not going to take the vaccine. However, from what we have seen around, people have really generated interest and they want to take the vaccine. I cannot count how many people who have called me, sent texts to confirm if vaccine is in Naima and whether they could come and take the vaccine. And we had to tell them that no. So no doubt that Nigerians are willing. Now, for what what is going on, like I said before, the Lagos State needs to reassess the situation, as it were, and discover what challenges they have, and then try to find solutions to this. Because Lagos State as epicenter will have a lot more people who will be interested in having the vaccine. For me, I believe that they should stick to the registration platform of the NPHCD and then use that to invite people who have registered according to the plans that the NPHCD has rolled out. I'm saying this because we have a little experience with our drive-through center. Everybody that has come to the drive-through center has had to register and then get invited before they come to have their test done. So if you get to the drive center, you will not find rowdy people. You will find a very well organized people coming to the drive-through at the time that they have been invited. So we do not have the place being rowdy as you would have expected.
Professor Salako, tell us what the experience has been with some of those who have received the vaccines from your casual observation. Are there adverse reactions, and what message would you have for the vaccine skeptics, who continue to apply sometimes scary messages, especially on the social media?
Well, we have said it several times that the public have seen the people who have taken the vaccine, the old, the young, among political leaders, among healthcare workers, and we haven't heard so far any serious adverse event from anybody. Although people say these are short-term events, that they are worried about long-term. And I always say you need to stay alive now before you think about long-term effect. Otherwise, if you are not alive now, then you are unlikely to develop any long-term effect. People have complained about small issues like pains, swelling, and we have also seen people who have developed diarrhea and fever. But all of these, as we are monitoring them, have disappeared within 2-3 days of the vaccination.
Yeah, because the vaccination is strange to the body chemistry. Invariably, there could be reactions. We read also that in some countries, like Australia, they stopped the use of AstraZeneca, because some persons, in that country had a serious adverse effect. In fact, one led to death, of a nurse, and they stopped. I don't know whether they have continued with AstraZeneca. But of course, in Nigeria here, I'm sure we don't have any such incident in this country at the moment.
Absolutely no case of death or serious, side effect. And in Australia, let's set the record straight. There was no cause and effect linked between AstraZeneca and the death of the individual, right? In science, for you to say something caused the death of an individual, you have to link it, by the pathophysiology. That is the process. You have to be able to explain how the cause led to the effect. This is why you now have, after an initial precautionary pause in the use of AstraZeneca in some 20 European countries, they have now restarted the use of AstraZeneca because an investigation was done by their medicines agency, and they found out that it is not correct that there's any link whatsoever between AstraZeneca and blood clots. So this is very good news, but for us in Africa, of course, when such bad news comes, when the good news comes, right, we're not sure that everybody who heard the bad news will also hear that, oh, the good news is that actually there's no link. That is why, I've always said that European countries should really be cautious before they take such steps.
Dr. Pfizer,
Yes.
I've been struggling to understand the purpose of an explanation provided by the DG of NAFDAC as to how to identify the genuine bottle of the vaccine. Is it that the vials are commonly available over the counter or something? They say the label you have on it is because of the place it is manufactured in India. Another one says, this is the original name. I imagine that when you received your batch, and that was a huge ceremony at the Abuja International Airport, as it was in some other African countries, that you took protective custody of those vaccines and then deployed them. So when the explanation was now coming, if you look out for this label, what does that mean? As I said, I don't understand it.
NAFDAC is the regulatory agency that is responsible for making sure that food and biomedical products, right, are of the right quality. And I believe what my sister, the DG of NAFDAC, is trying to do is to preempt such conversations and draw attention of Nigerians to the nature of the COVID-19 vaccine vial. That is a proactive action. But as it were, what we have done at the National Primary Healthcare Development Agency and the Presidential Task Force on COVID-19 is to send very clear guidelines to the states to say that after every day of vaccinations, you will retrieve all of the vials, and at the end of every week, you make sure that these vials are taken to a common pool at the state level. They are counted to make sure that it's exactly the number of vials you collected that you have retrieved. Okay. Then these vials will be burned, they will be crushed, and then buried, so that there is no opportunity for people to go and retrieve them, and then, before you get any fake or right. Yes. So there's only one type of COVID-19 vaccine vial that is available in the country.
Well, it's very good you have cleared this, because I was going to ask about vaccine accountability, in terms of ensuring that it doesn't, the hawkers, don't get into the issue of selling these vaccines using, the containers, of the vaccines. All right, so thank you. At this point, we'd like to appreciate you for being here this morning for this conversation. I'd like to first of all, thank the Director of Nigerian Institute of Medical Research, Professor Babatunde Lawasalako. Prof, thank you for coming this morning on our show. And of course, the Director and Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shoaib. It's a pleasure talking to you this morning.
Thank you very much for having me.
All right, you're still watching Good Morning Nigeria on the network service of the NTA. We'll take a short break now. When we come back, our next conversation will be on the security situation in Kaduna State. Stay with us.
Helen Paul!
Hello, madam. Would you like to join us on this mission?
Yes, but how?
Just one question for you. How do you keep your toilet clean?
I use regular detergent and bleach for washing and removing yellow stains. I have been using it for years.
Oh, madam, the regular detergents and bleach are used for washing clothes.
To disinfect your toilet properly, you need Harpic 10X. It is specially made for germs and stains remover. Harpic sticker formula settles on stains and gives 10 times better cleaning compared to regular detergent and bleach.
Wow, now I'm convinced, Helen Paul.
Really?
Yeah.
Now that she's part of the mission, the next house is yours.
Although social media as a channel of communication is inherently harmless, it becomes harmful and damaging when used without discretion and thoughtfulness. Bad social media users spread rumors and fake news without verification. But good social media users stop, reflect, and verify information before sharing it. Be a good social media user. Stop the spread of fake news. Verify the authenticity of your source and use social media responsibly for a better Nigeria. This message is brought to you by the Nigerian Television Authority, NTA, in collaboration with the National Orientation Agency.
wonderful news. The village headmaster is coming back to your screen. Mo wire abi mi o wire.
Teacher jọ̀wọ́, a fẹ́ lọ wá nǹkan jẹ. Teacher jọ̀wọ́, a fẹ́ lọ wá nǹkan jẹ. Ọmọ onírẹsì ti dé.
Ajebo na better school for last gidi. Not be all this on a rugged school for Ijabi. I don't know for you.
Second, it's called Oja Village. Kadesi. We know happy at all.
And I know that even you too, you are getting a lot of orders too. We are trying, Shao. Sweep her leg out. She was standing there. Sweep it.
I love you so much.
And how did I give you the impression that I was interested in that position?
50-year anniversary.
You mean anniversary?
I talk with that now.
Not for me.
You want me to die?
Not for me because of Pamio.
I'm a fire, no